So in this question, they have asked explain the terms proximal, coronal plane, medial position for 3 marks. So each of these you have to explain what is proximal, what is coronal plane, what is medial position. Okay, this is what they have asked. This is general anatomy. So let's get started. A very interesting question. Usually they don't ask this kind. Okay, proximal. Proximal means what? It's closer to the trunk or the torso or the root of the limb. Okay, so that is proximal. Distal is away. Okay, so within this, if you say within this is proximal and this will be distal. The proximal phalange, the distal phalange, right? So proximal is closer. I would say it is closer to the root of the limb or the trunk or the torso. Okay, and distal is away from this. Okay, so that you have to draw this diagram also and explain. It will be very nice if you can draw and explain. Okay, so you will just draw one arm like this and one hand. Okay, and then you will say that this is proximal and this is distal. Okay, next point. Next, what have they asked, guys? They've asked you coronal plane. Okay, coronal plane means it will divide the body into anterior and posterior halves. Okay, so this is anterior and posterior. See, this coronal plane can move. It's not exactly in the middle. It can go front, back, etc. Okay, so something will be anterior to something which is posterior. Okay, so this plane is not fixed here exactly in the center. That's what I'm trying to tell you. But what will you write in the exam? Coronal plane is a plane that divides the body into what? Anterior and posterior. Very good. So draw coronal plane for me here. Something like this it will be. Right? And here you have my anterior part and here you have my posterior. Okay. So this is coronal plane. Done. Which are the other planes that you should know? Right? You should know other things also because terminologies you should know. Sagittal plane. It will divide the body in right and left. Okay. And mid-sagittal means exactly in the middle. Okay. And again, this sagittal can move here and there. So little, you'll get right and left. Okay. Sagittal plane. Then you have seen what? This is coronal plane. There's one more plane called as transverse plane. Okay. Look at this. Transverse plane. Transverse plane means it will divide the body into superior and inferior. Okay, this is exactly in the middle, but again it can move up and down. So something will be superior and something will be inferior at all places. Like this is superior and this will be inferior, right? Relative. Okay, but if you divide the body in transverse plane means you're dividing it as superior and inferior. Okay. Horizontal plane also you can say horizontal plane. Very good. Okay, so the third terminology, guys, what is the third terminology that they have asked? Medial position. So medial position means it is near the mid-sagittal plane, okay, or more closer to the mid-sagittal plane. So that word closer should be there, not close, closer. It is closer than something else, okay. To what? To the medial plane or the mid-sagittal plane, okay. So what is medial position? Okay, then what is lateral? Lateral is opposite of medial. It is away from the medial plane. Okay, now let me explain. So first of all, this is sagittal plane. So in sagittal plane, this is the mid-sagittal plane. Exactly to the middle, if somebody is closer than somebody here, okay, then you can say that this is medial and this is lateral. Okay, so now let us look at the fingers. The fingers, this little finger is there, no? The fifth digit. It is medial. Very good. It is closer than the thumb to the mid-sagittal plane. So little finger is medial and your thumb will be lateral. Okay, thumb is lateral. Remember, thumb is lateral. Okay, so you got what is medial position. It is, you will explain in the writing. You have to write, right? Closer to the mid-sagittal plane. Okay, closer. ER, closer to the mid-sagittal plane compared to something else. That will become medial. The other thing will become lateral. Okay. Okay, thank you.